I'm joined today by Dr. Matt Parker, a neuroscientist at Portsmouth University. Matt studies the biology of impulsive and compulsive disorders in the context of stress. Thanks for coming today, Matt. If you just want to tell us a little bit more about what it is that you do for the people at home.
Hi, Mark. As you say, I'm a neuroscientist, and my research group studies the biological basis of impulse control. And as part of our work, we've done a lot of study of ADHD and ADHD-related symptoms.
My first question is one that I think a lot of people are either unsure or perhaps afraid to ask. In the context of ADHD and ADD, what are the differences between a neuroscientist and a psychiatrist and psychologist?
So if we just start with the sort of clinical side of it, psychiatrists and psychologists are clinicians. So psychologists tend to be clinicians that concentrate more on personality-based or behavioural-based interventions. So although they may work within the same framework in terms of whether somebody has a particular disorder or not, psychologists tend to favour treatments and interventions that are more behavioural-based or cognitive-based. Psychiatrists are medical doctors by training, so they do a medical degree in which they study to be a doctor. They then specialise in psychiatry later on in their career. Now, psychiatrists may also favour behavioural or cognitive interventions over medications, but by nature they are medical doctors. So they look at psychiatric disorders and so on from a sort of biomedical lens as opposed to simply a behavioural. Neuroscientists like myself are researchers. You may get clinical neuroscientists, so people potentially who work with neurodiverse people within a clinical setting. But neuroscientists are researchers through and through that study generally the biological basis of neurological systems. So not just systems that are disordered, but systems that are working, if you like, as nature intended. So looking at the molecular or biological basis of the way that our brains and nervous system work.
Okay, fantastic. And basically, we've had a lot of questions around diet and its effect on ADHD. In layman's terms, what do adults with ADHD or who are waiting on a diagnosis kind of need to understand about how diet works with the brain?
So this is a question that comes up a lot. I think the first thing that I would say is that there is not really a strong evidence base for there being a kind of dietary cause for ADHD. There was some talk going back 20 years or so about things like food additives and how that might cause ADHD. And in fact, there were some really big, well-funded studies in the UK and the US looking at, for example, E numbers and so on, and whether that might cause behavioural disorders, including ADHD. Interestingly, there was never any evidence that they do in the sense that we would, that we would require to say that this particular thing causes ADHD. There are some sort of correlation-based studies, so studies where they've looked at, for example, the levels of particular things in the diet and ADHD symptoms, which have had some links or at least have suggested some links between certain additives and so on and ADHD. But in terms of causality, that's never been really well demonstrated. So I think what I would say is that there are certain foods and certain food groups that we know generally are good for people. So, for example, proteins, complex carbohydrates, also things like berries and fruits, things like that, which we know have levels of kind of good additives, if you like, which are good for brain health and good for general functioning. There are also certain things that we know probably should be avoided, certainly in the sense that they're not good for your health generally, but also probably don't help in terms of brain functioning. And they're things like the simple carbohydrates, so white rice, potatoes without their skins, but also high sugar foods and things like, fizzy drinks that have very high sugar content. One of the food additives that often comes up in conversations about ADHD is caffeine. So most people will probably know that caffeine is present in tea and coffee, but also in certain fizzy drinks. There is some evidence that people with ADHD find that caffeine can be helpful to some of the symptoms of ADHD. the jury is out, so to speak, on the sort of evidence base for this, but certainly from anecdotal reports, it does seem like caffeine can be helpful for people with ADHD. So, for example, when you get up in the morning, it can help to focus and so on. But obviously, there are connotations with caffeine because it's a stimulant drug, so it can make you overly alert. So if you have too much of it, then it can be a bad thing. So I think that the take-home message really with diet is that, try to maximize good foods that we know generally are good for health, and try and minimize things that we know could have a sort of deleterious effect, if you like, and maybe negatively impact on neural function.
Okay, great. And how does eating foods compare with consuming vitamin supplements that we obviously see a lot about on social media and, different online ads, saying that they're going to be sort of a magical solution to give our brains, what they need? What are the right level of vitamins, and how can we ensure that we are getting them and the right things that our brain needs?
So the issue with vitamins is something that comes up a lot, and this is really based on a sort of marketing strategy, I suppose, by people that produce vitamins to try to make them more attractive to the people that they want to take them. Now, it is absolutely true to say that people with certain disorders like ADHD, for example, might have lower levels of particular vitamins, maybe vitamin B12, for example. Now, the problem is that the reasons for those lower levels do not necessarily mean that you can just replace them with a supplement. So it may be that people have lower levels of those particular vitamins or minerals, but there are differences potentially in the way that we metabolize things. So in other words, the way that our body breaks down foods into its different constituent parts in order for those things to be taken up by our bodies. It may be that people with ADHD, for example, have differences in that metabolic process. So by taking supplements, the problem is that all you're doing is metabolizing it the same way as you would if you were eating it in food. So it doesn't necessarily mean that by taking those vitamins or those supplements, it's actually going to replace that in the body. There are ways of maximizing the uptake of vitamins, which might be, for example, exercise and so on, but that don't necessarily correlate with the presence of that in the food. So what's important is that instead of worrying about what's missing and trying to replace it with vitamins, that you look at ways of maximizing the way that your body deals with those vitamins, which is often quite different from just taking them orally.
And if somebody who has got ADHD or ADD is unable to take medication for any reason, what else can they do to help with their symptoms?
So there are various ways that people with ADHD may be able to kind of self-medicate. Often what happens is that people will tend to self-medicate in ways that are not necessarily the most beneficial. So again, they may look for an easy fix. And obviously this could be, for example, with illicit substances or even with things like coffee or alcohol to try to almost numb down the symptoms. But these by definition will not help in the long run. They might help short term with sort of minimizing the symptoms, but they're not going to help long term. So what we do know from a sort of evidence-based perspective is that one way to, or a couple of ways that you can try to sort of minimize the symptoms, if you like. First is with taking regular exercise. So we know exercise boosts a lot of the kind of good levels of chemicals within our brains. It also helps to burn off energy, which is obviously an important thing to do if you're someone who finds that you have a lot of kind of pent up energy. We've mentioned diet already, so maximizing good foods within the diet and trying to minimize, foods that might have a negative effect. So again, a little bit of caffeine, but not too much and so on, and trying to minimize alcohol, especially at certain times of day. But another thing that's really important is trying to get a good sleep routine. So we're going to talk about sleep as well, but trying to make sure that you get into a good sleep routine, because sleep can have a huge impact on the sort of general health and well-being, and also can help or can exacerbate symptoms if you're not getting enough sleep.
So how does when and how we sleep work with our brain and the ability to function the next day?
So sleep is, pretty much every system on the planet with a nervous system needs sleep. We don't really understand a huge amount about it, considering everything uses it, but we know enough to realize that not having good sleep can have a really negative impact. Now, there's been a lot of anecdotal accounts from people with ADHD about having disturbed sleep. I mean, for one of the most common things that's reported is, people with ADHD find it hard to get to sleep. And once they are asleep, they tend to find that the quality of their sleep is disturbed. And there's various different reasons for this. It could be the fact that people with ADHD tend to do certain behaviors, like we've already talked about, in terms of, for example, self-medicating with huge amounts of coffee or alcohol or other things that might interrupt sleep. But also, people with ADHD often have high levels of anxiety. And obviously, if you're anxious, then it might mean that you're not really concentrating, or you are concentrating too much before you're trying to go to sleep, which means that you find it difficult to relax. So one of the things that can be very useful if you're trying to kind of, get yourself into good sleep habits is to try to adopt good habits around your sleeping. So, for example, get yourself into a routine where, you don't have lots of bright lights and so on before you go to bed. Looking at screens, for example, before you go to bed is a bad idea, because bright lights kind of trick our circadian clock, so our kind of internal body clock, into thinking that it's time to wake up. So if you start looking at a bright light when you're trying to go to sleep, then actually your brain will think, oh, it's time to get up now. Our bodies are entrained within the sun's cycles, essentially, which is why we tend to be awake during the day and asleep during the night. So a good idea is, try and minimize bright lights before you go to bed. Try to minimize things like coffee and alcohol intake for the sort of at least 3 or 4 hours before you go to bed, ideally. But also, when you get up in the morning, try to get up at the same time every day if you can. A lot of people fall into a bad habit of kind of getting up at different times every day, maybe, sort of setting their clock by their lifestyle, which often means that you get up at different times and then your body doesn't really get used to a particular type or a particular schedule of sleep. And when you do wake up, try to get light in your eyes as quickly as you can after you get to sleep. Within the first hour of waking up, try to, not stare at the sun, obviously, but try to get some sunlight and bright light, because that helps to entrain that circadian clock.
And what problems do adults with ADHD and ADD have with addiction, both kind of alcohol and illicit substances?
What we know is that people with ADHD and ADD tend to be much more likely to develop addictions. And part of the reason for that seems to be a sort of commonality between the two things, relating to what we call impulse control. So in other words, the ability to control our behavior in terms of, what we might want to do immediately. Oh, that looks like a good idea, I'm going to do that, without really thinking about the consequences. That's something that's common to people with addictive or substance abuse issues and ADHD. So it seems to be the reason that people with ADHD suffer with addictions more than the general population is because of that shared deficit in impulse control. Another reason may be, as we've said, about the self-medication aspect. So it might be, for example, with psychostimulant drugs, that people with ADHD find that when they take stimulant drugs, it has a sort of therapeutic effect and makes them feel a little bit more normal or a little bit more in tune with what's going on around them. A third issue may well be, as I've already mentioned, the sort of comorbidity, as we call it. So the likelihood that people with ADHD will also suffer with things like depression and anxiety. And obviously taking certain drugs or alcohol may help to numb some of those, anxious feelings or depressive feelings. So again, 3 ways really that make people with ADHD more likely to suffer with addictions.
How do you find this affects relationships? Like, what challenges do adults with ADHD have in relationships as a result of their symptoms?
People with ADHD are likely to have difficulties with interpersonal relationships, in the sense that if you are neurodiverse and you experience the world in a different way to other people, then, those people need to be able to fit into your life. And, if they don't fit into your life, then that can make it very difficult to get on. So it might be that the person is quite happy with their relationship, or they're quite happy with how things are happening, but that might not be the case for the person that they're sharing their life with, because the sort of nature of ADHD is that things tend to be fairly disorganized and you tend to act quite impulsively. So while that might be nice in certain aspects, it might also not be nice if you're trying to sort of settle down and have a more calm life. So I think it may well be that people with ADHD struggle with relationships in the sense that it makes it difficult for other people to fit into their world as opposed to them fitting into other people's worlds, because fitting into other people's worlds doesn't necessarily, that means that you need to act in a way that fits into their world, which kind of goes against the nature of what happens with ADHD.
And is there any link between ADHD, ADD, and OCD?
There is a link between attention deficit type disorders and obsessive compulsive disorders, so OCD, in the sense that they are all what we call impulsive stroke compulsive disorders. So there are a whole bunch of these, and actually addiction fits into this as well, which are what we would call disorders of impulse control. Now, obsessive compulsive disorder is obviously quite different to ADHD in the sense that it tends to talk about people focusing on particular things and feeling that there'll be catastrophic consequences if they don't do that. And so the sort of compulsive behavior comes into it, whereby they'll carry out certain behaviors to try to ensure that certain outcomes won't happen. So although they seem quite different on the outset, actually the brain systems that underlie attention deficit disorders and obsessive compulsive disorders are quite similar. So there will be some symptoms that cross over between the two, and people with ADHD may be more likely to develop obsessive compulsive disorder as well because of those shared sort of brain systems.
I mean, we've talked a lot about the challenges around ADHD. What are some of the unique strengths and skills that are useful in adults with ADHD, particularly in the workplace?
So there's a lot of quite interesting research that's been carried out on the links between creativity and ADHD. So I think we tend to concentrate very much on the negatives of ADHD, in a sort of clinical sense, if you like. But actually, there can be some positives of having that sort of neurodiverse brain system, if you like. Now, one of the things that has been linked to ADHD a lot is creativity, and the idea that because people are impulsive and easily distractible, actually those are qualities that are quite strongly linked with creativity. Now, there have been several theories about this. So in other words, people have posited that this might be it might be that ADHD and creativity are linked. Again, a lot of people with ADHD tend to find that they do well in creative roles. Now, I guess from an evidence-based perspective, it's not quite as clear, in the sense that when they've looked at this in studies, what you tend to find is that people that have subclinical ADHD, so in other words, ADHD symptoms, so maybe sort of high levels of impulsivity and distractibility, but it doesn't quite match the clinical definition of ADHD. They tend to be people that are very creative, but actually when people have clinical ADHD, the link with creativity sort of diminishes a little bit. But I think this is actually a really critical point, because I think what this kind of tells us really is that, in terms of clinical definitions, when somebody is clinically on the ADHD spectrum, that typically means that they've reached a point where they are, struggling in their life because they've gone and sought help, or it has been sought on their behalf because they're struggling in life. So it may well be that by the time somebody is actually seeking help for ADHD, it's got to a point where that creativity's almost been kind of crushed, if you like, by the rest of the ADHD symptoms. So I think it's something that definitely is worth thinking about in terms of research in the future and how we can best harness it. But I think it ties into finding appropriate interventions for ADHD that people can embrace, people who have ADHD can embrace and work with to try to bring out those positive aspects, those creative aspects, which obviously can be really beneficial, and try and minimize the negative aspects, which obviously, as we've already talked about, leads on to potentially negative things like relationship problems, anxiety, depression, addiction, and so on.
What other unique strengths do adults with ADHD have that perhaps would surprise people?
I think there are a couple of things that might surprise people about, some of the sort of personality characteristics of people with ADHD. The first thing is that there is evidence from when you look at sort of personality tests and so on, people with ADHD tend to be high in empathy. So in other words, they tend to be good at sort of understanding emotions in other people. Now, obviously, that can be really useful if those, if that person then wants to go into a career, for example, or that requires being able to listen to people and being able to understand people's perspectives. Because I think that's something that fits in well within general kind of social activity as well, but also can potentially work well within the workplace. Another thing that obviously people with ADHD that can be a negative but can also be turned into a positive is the idea to kind of make decisions very quickly and be a doer rather than sort of a passive member of a team. So often people with ADHD, because of their impulsivity, will be more likely to make sort of snap decisions. Now, you know, interestingly, within human psychology, there is evidence that when you take a lot of time to come to a decision, that can often be a negative thing. Especially if that's done in a group situation, is often the more you ruminate about a problem, the less likely you are to come up with a good solution. So often, the first decision that you have will be the right decision or be a good decision. So I think people with ADHD maybe need to harness that a little bit more, and find their place within a kind of decision making framework that allows them to then make the most of that particular skill.
Got it. And you talked a bit about impulsivity. Like, what can adults with ADHD who have impulsivity do to either control or manage their impulsivity?
Managing impulsivity is difficult because it is what we call a personality trait. So it's a kind of underlying personality dimension, which means that is how people tend to act in certain situations. So I think, there are obviously, medications can help, but I think, it's good to think about how things can be done without medication as well. I think one of the things that can really help with impulsivity is kind of being self-aware. I think having an understanding that you have impulse control issues can probably help to have you think about it a little bit more. I mean, just to sort of explain, what impulse control is. I mean, when you need to do something, or when you go through life, you have to make decisions all the time. And impulse control is where, imagine you've got a kind of accelerator and a brake in the brain. Usually those two things work well together. So if sometimes you need to press the accelerator, sometimes you need to press the brake, and you need to kind of do that in a way that allows you to flow through the traffic well. Impulse control problems is where the brake maybe doesn't quite happen at the right places. So maybe when you need to brake, you're not braking in time, or maybe you're pressing the accelerator when you should be pressing the brake, and so on. So it's kind of that balance doesn't quite work. So I think being aware of it and sort of thinking through problems, and again, I already said that it can be a positive thing in some situations, and in fact, people who were impulsive may have been the ones, the sort of pioneers, if you like, who built the first roads and made those difficult decisions early on. So, it's not always a bad thing, but in some situations, having, making impulsive choice is probably not the right thing. We've talked about relationships, we've talked about, drug use. It might seem like a great idea to walk out of your home after you've had an argument, but maybe that's not a good idea. Maybe that was the thing that you probably should have sat back and thought about rather than just doing it. Similarly, it might not be a good idea to, take that, pill at a club or something. Maybe that, that is not the best thing to do. So, again, it's being able to think things through and actually think about times when impulse control is useful. But being sort of trying to harness it in a way that allows you not to kind of squash your personality, but also try and learn when it's appropriate and inappropriate to do things. But again, I'm not saying that this is something that is easy, because that's the nature of ADHD, is that those things don't automatically come to you. So, trying to help by, doing sort of training exercises and thinking things through can be helpful. And that's actually how a lot of sort of cognitive behavioral therapies and so on work.
What do health services and researchers like yourself know about ADHD compared to, say, 10 to 15 years ago?
So the research has come on a long way in the last 10 to 15 years, although depressingly, we haven't really had any new drugs or anything that have helped. And I think that actually reflects the sort of complexity of ADHD and the fact that, in a clinical sense, one thing that's really important to remember is that, clinical diagnoses like ADHD are there for the convenience of clinicians. They were never really designed for patients. They were there for clinicians to be able to say, okay, this person falls into that category, therefore this particular type of drug might work, or this particular intervention might work. If for epidemiological processes, this many people suffer with this disorder and that disorder. I think what's important to remember, though, is that even though you may have a diagnosis, everyone is an individual. Everyone has a different experience of this. So there might be certain aspects of it that, that fit with you and certain aspects that don't. So I think what we've learned really in research and where research is kind of going is actually informing clinical practice. Now, what everyone is moving towards in psychiatry generally is what we call individualized or personalized medicine. So what that means is recognizing individual differences and particular types of, for example, symptoms that one person has but another person doesn't have. And even now, with the power of kind of genetic sequencing and so on, we're able to look at that even down to a molecular level. So, a person has a particular genotype, which means that they have a particular gene that's different from other people that might produce a different protein or whatever. Those sorts of things can be very specifically related to different behaviors. So by building up that kind of genetic landscape on an individual basis, we may be able to come up with drugs, certainly in the future, that allow us to understand more about that individual's experience, and then we can target particular aspects of their condition. Now, that has happened already in some other disorders. So, for example, in depression, there are drugs or there are tests and so on now that we do to recognize what particular drugs people will respond better to. So we can do blood tests, very simple blood tests, which tell us about how people, how their bodies kind of metabolize particular components of certain drugs, which really are a very good indicator as to whether things like SSRI drugs, like fluoxetine, which is very commonly used in depression, how well that will work for that individual. So we're not quite there with ADHD yet. And obviously we know there are, various different types of drugs and interventions that are used for ADHD. So the sort of stimulant drugs like Ritalin, and the non-stimulant drugs like atomoxetine and so on, which target different brain systems. Now, some people respond well to stimulants, but don't respond well to things like atomoxetine, noradrenergic drugs, and then vice versa. So it would be excellent if we could get to a point where we could recognize who was going to respond well to particular types of drugs, because then we could have more focused, tailored, individualized treatments in the future. But we aren't quite there yet.
How do you think health services could be doing more to support those with ADHD, given the current situation we have, like diagnosis backlogs? So generally there will be a period between somebody seeing a GP and then waiting a year or more to actually get a diagnosis. What could the health services be doing in the meantime?
I think health services need to make sure that the frontline workers, so GPs, nurse practitioners, people who are seeing patients at the front line, need to be educated on ADHD, but also on other, other mental health type disorders. But obviously there is a capacity issue, so one has to be mindful of that. But I think, being within the sort of the frontline services, being aware of the different potential interventions, not necessarily just medication, but being aware of the sort of interventions would be really useful. Now, I think one of the problems we have generally in frontline services, as well as a capacity, which goes without saying, I guess, is that there is this, I guess, there is a tendency for psychiatric related problems to be treated a little bit more like general medical problems, where it's like, you go in and you suffer from migraines, so here's some pills, go and take those when you get a migraine and everything will be okay. I think the understanding amongst researchers and amongst most clinicians that mental health doesn't work like that, and that actually it's an ongoing thing that needs ongoing treatment probably, but also needs a certain level of empowerment of that individual. So if you treat ADHD like you're treating a sort of physical health problem, then I think you're probably shooting yourself in the foot a little bit as a clinician, because the likelihood is that will not fix the problem. So I think ideally we would get to a point whereby mental health was treated in its own right, in the sense that you would get ongoing support, but also that there would be more self-help type or empowerment type things built into the health service, so that people were able to learn to manage their symptoms and actually thereby learn to live their lives in the way that they want to and get the most out of it.
In terms of ADHD and ADD in women and young girls, what is the difference between how they present and say how like young boys or men present?
The first thing to say is there is evidence that there is a sort of sex difference with ADHD, in the sense, and actually you see this in so some people will do research on animals, for example, of models of ADHD. So they'll induce ADHD like symptoms in rodents and monkeys or whatever, and even fish. You do see sex differences, right? So that's the first thing to say, is that what's clear is that the male of the species, whatever that species may be, tends to present with more of a hyperactive phenotype. So in other words, their behavior will be more sort of acting out, externalizing behaviors, whereas the female will tend to be more internalizing behaviors. So in other words, they'll tend to withdraw a little bit more, and although the attentional deficits will still be the same and the impulse control deficits will still be the same, they tend to do it in a more kind of within themselves a little bit more. So there are sex differences. Now, that means by nature that in the past, when we didn't really understand a lot about ADHD, it tended to be that the reason people got diagnosed was because they would present at frontline services with ADHD symptoms. Now, because boys tended to have more of the externalizing symptoms where they were acting out, sort of running around the classroom and jumping up and down and screaming or whatever, when they were not concentrating, that tended to be much more obvious to people, which meant that they were more likely to get a diagnosis. The girls may have become more internalizing and kind of sat quietly in the corner, and although they weren't learning and weren't engaging properly with the educational system, it's a lot harder to pick that out as an external observer. So I think one of the reasons that ADD, which is the sort of version of ADHD without the hyperactivity, attention deficit disorder, but without necessarily that kind of external acting outside of it, that's more common in girls and is less likely to be diagnosed, is because of the fact that those people don't typically, for example, in children, get sent forward for educational assessment and by parents as well. Also, there tends to be a sort of crossover between that and things like depression and anxiety. So it may be that girls were historically sort of misdiagnosed with anxiety or depression as being the primary symptom, whereas in fact ADD may have been a more appropriate diagnosis. But it's getting better now, I think, because the diagnostic tools, ironically, after I just said that they weren't that useful, they are useful in terms of things like that, because they can help to understand whether somebody has one thing that needs treating or needs concentrating on from a clinical perspective, as opposed to another thing being the primary diagnosis. If you only treat, comorbid things, then you miss the main diagnosis, and then of course you don't really ever fix the problem.
Okay. And phrases like, I think everyone is on the ADHD spectrum a little bit, get thrown around quite a lot. Do you think this is the case? And if so, why?
So again, this goes back to the idea of a sort of ADHD spectrum, goes back to what I was saying about ADHD as a clinical diagnosis being a tool for clinicians. And I think that's never been truer from what you just asked. So in the sense that everybody is on the spectrum, well, of course, everybody is on the spectrum of certain behaviors, right? So everyone has the capacity to be impulsive to a point. Sometimes you do need to make snap decisions, and sometimes you don't, and everyone is going to fall somewhere on that spectrum. So some people can probably never make their mind up about anything, right the way through to people that have spent absolutely no time about making a decision at all. The same with hyperactivity. Sometimes people feel quite hyperactive and sometimes people feel very lethargic. So there is a spectrum for all of these. And the same with attention. Even the sort of least ADHD type person you would ever meet might still get bored and frustrated if they're sat in a room staring at a wall without doing anything for hours and hours and hours. So there's always a spectrum for everything. So I think saying that everyone is somewhere on that continuum is probably true for the different behaviors that underlie ADHD. But I guess then you would get into an issue of, well, they might be, slightly higher in impulsivity, but then they might be much lower in hyperactivity, for example, or they might be, quite high in impulsivity, but actually they're able to control everything else in their lives. So from that perspective, that spectrum kind of description fits for particular behaviors, but probably not for ADHD as a kind of cluster, as would be considered within a sort of clinical sense,
There's a lot of talk around how we spoke earlier about impulsivity and impulse buying is a big thing. Like, how can, ADHD affect someone's like finances throughout their life?
So, unfortunately, there is a lot of evidence that people with ADHD tend to make more risky decisions. Now, obviously, if if you're an investment banker, that might be a good thing, especially now that they've lifted the the cap on that. I don't want to get political, but maybe making risky decisions in some scenarios might be quite good. But generally, if you look at for example, lifetime household finances, if somebody makes risky, impulsive decisions all the time, the likelihood is that long term they're going to suffer. So the same goes for other aspects. So, for example, in the workplace, there is unfortunately evidence that people with ADHD tend to struggle more to hold down jobs. They tend to, when you look at their lifetime success in terms of financial things, like their income and so on. Often there is, on average, this doesn't mean everybody, but on average, they tend to not do as well as people that don't have ADHD. Now, the reason for that is probably relating to the impulse control, in the sense that if you have problems regulating impulse control, as I've said before, it's going to have impacts on lots of aspects of life. So things like financial decision making, but also within the workplace and so on. If you're very impulsive, then it might be that you don't make the right decisions in terms of, maybe it would take time for you to, build up skills within the workplace in order to get promoted and so on. So you can understand why that might have an impact. But yeah, but as we've already discussed, there are some positive aspects to being impulsive, and you may find that it's what we might call a bimodal distribution, and that, in scientific terms, that means that you get sort of two groups within a population. So if you imagine people with ADHD, some people do quite badly, and then some people might do very, very well, because it might be that they make impulsive decisions which happen to turn out right. And if you imagine that you go through life flipping a coin, if you happen to flip the coin at the right time, and that impulsive decision happens to be the right decision at a particular time, you might win really big, which might then set you up. So I think it's difficult to sort of tar everybody with the same brush, because all you need is to find one person with ADHD who's made £1 billion, and then you find out that actually, that theory about everybody is wrong. So I think it's better to think of it in terms of, on average, people who make risky decisions and have problems with impulse control are likely, on average, not to do as well in life, because that's just the way that probability works. But some people may do very well with it.
Okay, one last one, which is, which areas of neurology, ADHD do you hope to research more in the future?
I think where we are at the moment in terms of ADHD research is we're very much at the point of trying to understand the underlying biology. So, I've mentioned a few times already about the fact that everyone's an individual. One person with ADHD is likely to be completely different to another person with ADHD. And in fact, although there are some symptoms that are similar, they're no more similar in other aspects of life than they would be with anyone else on the planet. So I think one of the things that we recognize in research, and one of the things that neuroscientists like myself are trying to understand now, is the molecular basis, so the sort of genetic basis of certain aspects of ADHD, but also individual differences at a genetic level, but also at a sort of neurological level, that lead to people, to what causes ADHD in terms of the sort of underlying neural differences, but also, really importantly, who will respond well to certain types of drugs, and whether there are new drugs or whether there are different types of drugs that might work better for other individuals. So I think, that understanding the biology of ADHD and using that to try and help us develop more effective personalised treatments is really where we're going with it.
Thank you, Matt. It's been very interesting. And if anybody has any comments or any other questions they have about ADHD or ADD, then please leave a comment below.